Our next speaker for today is Marjorie Cadogan. She will be speaking to us about the promise and limits of federal health reform, including the Affordable Care Act and its associated efforts. So, without further ado, Marjorie Cadogan.
Thank you all very much, and thank you very much, Brooklyn Free Clinic, for having me here today. So we've already heard a little bit about insurance and its limitations, and a very compelling talk on human trafficking. I'm going to be a little bit more mundane and take you on a road trip. Just to go forward. You know how when you go on a road trip, some of us like to have a map, have a sense of where we're going. In fact, when I came here today, I always like to know where I'm going, so I went on map quest and kind of plotted it out, like to be prepared. Some of us have a map and don't use it. I won't talk about gender at all. And then some of us take the map and have it as a reference guide. When we get to, point A or landmark A, we take a look and we see where we are. Well, I'm going to take you on a road trip today. And it's a road trip about the Affordable Care Act. So, as my title says, From Here to Health Insurance, will the federal health care law take you there? And for some it will. And as it was clear from our first talk, for some it won't. But let's take you through our kind of first part of the journey, which is to understand some of the protections and benefits and the things that are coming your way by virtue of the Affordable Care Act. But let me step back a minute and give you some background on your tour guide, which I am. I had an office in New York City called the Office of Citywide Health Insurance Access. Some of you may know about it. For some of you, it's the first time you're ever hearing that there's such an office in New York City. And our mission is to expand access to health insurance. And we do that with a broad array of partners, including providers and others, to help us find, help us teach, and help us educate New Yorkers about their options and how to use them well. And a bit of the work that we do is these kinds of events to get out there and share information. So in talking about the Affordable Care Act, I want to talk about four things. The protections and benefits that are available and some that are coming away. The new way to buy health insurance through an exchange. And in New York State, there will be something called the New York State Health Benefit Exchange. Mandates and tax changes that are a consequence of the law, and changes for small and large businesses. And why it's important for us to be cognizant of what's affecting small and large businesses is because we know that a great portion of the uninsured are working. Many of them working in small businesses, and in New York City, when we talk about small businesses, we're talking about businesses from 1 to 5 employees, very small. So, protections and benefits. Some of the things that are already available to you by virtue of the Affordable Care Act passed in 2010, the fact that young adults up to age 26 are allowed to stay on their parents' plans. There is a ban on lifetime dollar limits on benefits. Also, there is, I'm trying to read, standardized plan information that is going to be available so that you can really understand some of the terminology and jargon that pertain to health insurance coverage. Another important thing in terms of the spending of your money on coverage, there will be premium rebates if insurers do not spend 8% of the premium dollar on care. And that's already happening. There have been significant rebates from insurers to consumers by virtue of that, what's called medical loss ratio. And then finally, for new non-grandfathered plans, they will look different. They will have a new package of benefits, free preventive care, additional preventive care for women, and more importantly, minimum benefit standards, including new benefits, mental health and substance abuse coverage, and other things, prescription drugs, etc. The other thing that is important for you to know is that individuals and families will be able to shop for coverage in one place, both public and private. The way health insurance works in this state, and it works in many places, is that public and private health insurance operate in two different ways. And that's often very confusing for folks who may be eligible for programs like Medicaid or Child Health Plus, which are the public programs, or private health insurance where if you're a small business, you have to find a broker, or otherwise, if you're severely ill and have to buy on your own, figuring that out is often a challenge. Well, now there'll be one place, the exchange, the marketplace, that terminology is starting to kind of come into vogue, where you'll be able to find and purchase and compare coverage. Also, there will be new tax credits to lower the cost of the monthly premium, and for some, there'll even be additional help for out-of-pocket costs. So the conversation about medical debt this morning was very apt in that we know that the premium is not the only thing that one has to consider in terms of medical costs. Those out-of-pocket costs are very important. So for many families and for individuals, there will be additional what's called cost-sharing subsidies. There'll also be tools to help businesses and consumers select a plan. There'll be tools within this virtual marketplace. There'll also be a program that you should know about that operates now called the Consumer Assistance Program that can help consumers with issues about payment by their insurers and be able to help them with the appeals and other grievance processes that they have to go through. The exchange accepts applications very soon, October 1. That feels like a moment away, and it is. October 1 is the time when the exchange in New York State will begin to operate, that you will start to see and hear a lot more about this virtual marketplace. But I hope you'll be paying attention to information that you get before then. Coverage begins to be available January 1. So those are two key dates, October 1, and January 1. Then, in 2014, which has always been the big benchmark year for the Affordable Care Act, individuals will be covered under an individual mandate. What does that mean? The individuals will be required to have insurance or pay a penalty unless they can claim an exemption. And there are a number of different categories under which one can claim an exemption. If one is undocumented, and I'm going to talk about undocumented when we get to the challenges of the Affordable Care Act. If you have a religious objection, if you've earned too little to pay taxes, and there are a host of other categories that allow you to be exempt. Okay. Good thing I know my presentation, that's a test. In addition to having to pay the penalty, if you are able to get insurance, have available employer-based insurance, also the thing that you should be cognizant of is that, and I hope we can get this slide back up. The thing that you should be cognizant of is that there also will be help and procedures within the exchange to be able to claim those exemptions. So going beyond the protections and benefits, let me talk a little bit about the exchange itself. The exchange is a place where individuals and small businesses will be able to acquire subsidies based on income levels, individual and families. And there also will be, for small businesses, something called the Special Health Insurance Options Program, or the SHOP. So for businesses of a size of 50 employees or under, they will be able to purchase insurance in the exchange, offer choice, which is something that is difficult for small businesses to do. Most small businesses, whatever the boss gets, the employees get, but there'll be the ability to offer choice, and that's been something that's being pushed in New York State. And there will be a tax credit for small businesses of up to 50% of their costs starting in 2014. So again, an incentive to help small businesses who find it very difficult to offer health insurance to do so. For large businesses, so there's a mandate for individuals, and for large businesses, there's also a mandate. And that is that businesses with more than 50 employees will have to provide adequate, affordable coverage for full-time employees, and full-time is defined as employees working more than 30 hours a week, and their dependent children, or else they'll face a financial penalty if these workers go into the exchange and seek exchange coverage. The way insurance works is that there needs to be kind of a pooling of dollars and risk. So the Affordable Care Act is really trying to keep employers engaged, both small and large, in the purchase of insurance. Finally, I want to talk about challenges, because the picture is good. The picture has become a little bit better with the resources that are going to be available through an exchange with subsidies, but there are issues. What's that date that I mentioned to you, the first one that you have to be cognizant of? Okay, not far away. All of this has to be up and running and ready for consumers. October 1, October 1, October 1. Those of us who are in this business look at October 1 and tremble, because it is not far away. So one of the first issues is having all of this infrastructure, this virtual marketplace, the consumer assistance, the programs to help consumers. And there's another program that I should mention called Navigators. They will be folks that will be available through organizations around the state to actually provide in-person assistance. They have to be trained and ready by October 1. So having that cadre of in-person assisters and navigators and others ready is also a challenge. Finally, educating consumers, which is why I'm here. Because educating consumers is all of our jobs, not just our personal responsibility, but all of us need to be well in the know so that we can share this information, consumers and businesses, about what their options and opportunities are. But the Affordable Care Act is not only about coverage. I'm certainly talking about coverage because that's where I live every day in my work. But where you live is on the care side. And the challenge is there too, because we're talking about in New York City some possibly 500,000 more people having insurance. And insurance, hopefully, is a ticket to quality care. But that means we have this cadre of 500,000 more patients coming into the healthcare system. What many speculate that means is a real shortage of primary care for this population, and the need to really maximize our ability to use all levels of clinicians to serve this new population of patients. What it also means is that there are some folks who will not be insured. I talked about the exemptions before. New York City is a unique and diverse city, and has one of the largest populations of undocumented in the country. The undocumented population is not eligible for the benefits in the exchange. And we have, in New York City, mixed immigration status families, where we have these parents who are undocumented and children who are citizens. They have to understand what the opportunities are for their children, but yet, the parents still have to be able to find and get quality care. So the maintenance of safety net providers, like our Health and Hospitals Corporation, like community health centers, like other outpatient facilities that serve individuals regardless of ability to pay, are going to be vital, and in fact more vital with coming of the Affordable Care Act. So let me ask you again the dates that you have to remember. Remember those dates. Pass those dates along to your patients, to your family, to your colleagues, to the grocer on the street, and help us all make sure that New Yorkers get the best they can out of the Affordable Care Act and its implementation. Thank you.